Hi, welcome to the channel. I go by the name Dr. Achievement. In this video, I'm talking about a quick way you can diagnose the pain you're having right now. Number one, we have the bone. Number two, we have the muscles. And number three, we have the nerves. Right? This is the three main common structures. So, how can you diagnose your pain if these three structures are there? First of all, you have to define your pain. We have something called acute pain, we have something called chronic pain, subacute pain. Acute pain, like let's say I went to play the game yesterday, like football game, and I have injury, I would say that is acute pain in less than 24 to 48 hours. Alright, now subacute pain, okay, I went to play the game, I had the injury, less than 24 to 48 hours, but it persists after for 24 to 48 hours, say until 1 week. Subacute pain. And chronic pain, it happens continuously until months, continuously the pain is still there. So now we are getting somewhere, right? Because I'll be using these terms and I don't want to define them again. So how to know what pain you're having? For example, we need to know the characteristics of pains. All right, now these three structures which I've called, we have three different characteristics when pain happens, when some issues happens to them. Number one, we talk about the muscles. Muscles have a dull sensation pain, like you're feeling the pain and it's always localized, except the muscle is a longitudinal one or a muscle which is long, it will be having, and basically it will be at the region of the muscles, right? You don't have to know where the muscles is located, you just know here is the pain. You don't know the origin insertion of the muscle, no problem, but if the pain is just here to here, stopping from here, stopping here, fine, this is muscle. All right, so you need to know how it can happen. Now if it's stopping here, I'm having the pain here, it's always dull pain. And why I say this localized, because this area is just a local area. It's just like a community, it's happening in this community instead of a state or the country as a whole. You know the difference between that. Now let's talk about the nerves. Now nerves is not a localized pain, it is the radiating kind of pain. It can happen in the community, take it from the community to the states, which I just explained, take it from the states to the country. For example, if there's a compression at the neck, let's say the C5, C1, C2, C3, C4 spinal cord, if there's any compression there, the pain can be referred to this area. You'll be having pain at the neck, definitely. The pain can be referred to the shoulder because C4 is supplying to the shoulder joint. Definitely, C5 is coming to this area of the hand, so it's crossing the CT. Now, C6, if it's affecting C6, C7, C8, they are coming to the fingers. C6, this area of the dermatome. Let me not bore you, but I'm just trying to explain so that you will understand very nicely on how it's happening. Now, the pain compression is here, then the nerves is supplying till this point, right? There's something called numbness, will feed numbness sensation in that aspect, right? So the nerve is in pain. If you have anybody who is having this, nerves is playing the role. Okay, coming to the bones. This is the bone of the radius bone. It's this one at this area, ulnar bone at this area. Now if there's any fracture here, it can be localized, but it has a sharp kind of pain. You feel it so painful, so sharp, you know, then you can know your bone is involved. Then we have the other ones like osteomyelitis, especially for the knee ones, osteoarthritis. You know, when you're walking, only when you're using the joints, you're having the pain. Then you know something like osteophyte formation is there. Osteophyte remain like a bone is growing, but it's not supposed to grow there. You know, so it's there causing the issues as you're moving your hand and you're feeling pains. All right, mostly it occurs in elder individuals at their. I saw a patient one time at their joint in their finger. Her finger was just stiff and she was having issues bending it. I gave her an advice to use exercise exercise. I gave her a hand grip machine where she has to be gripping the stuff continuously, and she got better, right? So exercise was the issue. So guys, this is a way you can diagnose your pain. You can say, okay, when is this pain? How did this pain occur? How is this pain radiating? Hit the subscribe button for more advice, and click my other video and watch to learn new things.